Thank you for the second Health and Human Services Committee meeting today. Thank you for being here. And if we can get, if you don't mind closing that door, appreciate that. Senator Hatchett. Chairman Huffstedler, would you mind opening us up in prayer today? You're in, is that 8?
And 8, yes, sir. All right, if we could all pray. Our dear Heavenly Father, we thank you this day for the day you have given us. We know you've been good to us this day and all you provided us with. We thank you for the opportunity to be here to give out wisdom and courage and justice and moderation and the things that come from you that you give us in making these decisions. We pray that you could continue to bless this state and watch over and protect us. And we ask all this in your name. Amen.
Thank you, Chairman. So today we have one bill this afternoon. It's going to be Senate Bill 403. So I've been working with the Lieutenant Governor on this. I am going to present it. So I'm going to turn over the meeting to Chairman Burke, and he's going to sit here and run this. And I'm going to come around and we'll go from there.
Thank you, Mr. Chairman. So we will get started on Senate Bill 403. And Chairman Watson, why don't you read the LC number just so make sure everybody's on the same page.
I have the most recent copy. I apologize about that. Here we go. Thanks. We've had several versions here, and so we're on LC 339007S. And that's what it does, the introduction, in that this bill, the co-responder bill, is something that Lieutenant Governor's been intimately involved in and has been working. And I must say that his office and our legal counsel, Regina Quick, and I, and multiple parties have been working on this together, including to my left, Judge Sweat. I'm going to give just a little brief overview, and I'm going to turn it over to Judge Sweat, and then we have a few others to testify. So, as you may know, I do primary care, internal medicine, been doing it for about 30 years, and you know, a lot of internal medicine practices and all primary care physicians, whether you're family medicine or OBGYN, do psychiatry. I mean, it's basically at least 25% of our practice. Just because you have diabetes and high blood pressure doesn't mean you can't have other mental health issues. So having said that, though, what we're here today to talk about is to help address the mental health care of our patients, of our citizens in the state of Georgia. I was in the House for 4 years, 8 years here in the Senate, and we've been doing mental health legislation almost every year. We're obviously doing more mental health legislation this year, and it is the role of government to serve as the safety net for people who need us in crisis. And this is what this bill helps to address. Do I think that we're going to end all mental health issues in the state of Georgia this year? By no means. That is not what we're doing, and we'll be doing mental health legislation in the future. But I think this is an important piece of the puzzle that we will be doing and are doing. If you'll turn to the first section there relating to mental health, and you'll see that you know, it discusses section 2, I really should say, it discusses the demands on law enforcement and peace officers in our citizens who may have mental or emotional, developmental disability, addictive disease, and the benefit of the behavioral health specialists in this. When we do correspond with law enforcement, this allows an exponential decrease in the risk of escalation. And what this does, hopefully, we're leading to not necessarily an arrest, which may not be needed, but a intervention in this particular person's crisis. The law enforcement agencies, at times with jails and prisons, both the community service boards, the behavioral specialists in the community, and law enforcement know these individuals that are in the emergency rooms and are on a revolving door in our jails systems where they do not necessarily need to be. Several law enforcement agencies, as you'll see down there, number 5, including to my left, Athens, Clark County, Forsyth, which we're going to hear from, Chatham County, which we're going to hear from, and others, including Fulton, DeKalb, and Carrollton. So less than 10 have formed these co-responder units in the state of Georgia. And what we're here today to do is to allow law enforcement to work with the community service boards. We are empowering and demanding the community service boards to come up with a framework that if law enforcement wants to use them, not exclusively, they're not required to do that, but if they want to use the community service boards in their co-responder apparatus, then that's what we're asking to be done. So less than 10 have done it in the state. There are now, under current Georgia law, the community service boards, there are 23 in the state. And so what we're asking is to establish a framework for behavioral health specialists and law enforcement to continue to work in the community-based partnership if we can get this legislation passed. And I'm going to turn it over to Judge Sweat to sort of go through the bill and to give us some experience here. And then we have several people who want to testify.
Thank you. Thank you. Thank you, Mr. Chairman. And if I may introduce myself, I'm David Sweat. I am a senior judge of Superior Court. I was served an active service with the Western Judicial Circuit, which is Athens, Clark, and Oconee counties for 15 years. And in 2017, I took senior status and have continued to serve. And this has been one of my great pleasures to work in this intersection of justice and mental health, because this is a place where we see a great deal of suffering with individuals, and we see a great deal of community effort and resources being expended. And this co-responder bill will allow us to do that in a much more coherent and skillful fashion. The bill creates a framework for the co-responder model. And the co-responder model is the idea that we can partner a trained law enforcement officer with a behavioral health specialist, a licensed clinical social worker, or a LPC to respond to scenes where individuals are in behavioral health crisis. And the bill does this by creating the part of the opportunity for the community service boards, which are our safety net mental health providers. They're the ones in our communities that are ensuring that individuals have access to substance abuse and mental health, and also developmental disabilities treatment. And they are the front line of our mental health and substance abuse efforts. This bill will create the partnerships between law enforcement and behavioral health to try and address particularly the individuals who are familiar faces to both law enforcement and to the mental health workers in the community. The bill provides that in Section 5 that each community service board will establish a co-responder program. Community service boards serve sometimes in DeKalb County, there's one community service board, one county. I'm a member of the board of the Advantage Behavioral Health Services, which is a service board that serves Athens, and it also serves 9 other counties. So some of these community service boards have quite broad areas and work with a number of jurisdictions. We have about 700 police agencies in the state of Georgia that respond to emergency calls, and this will create an opportunity for partnership between the co-responder partnerships between those agencies and our law enforcement, our community service board. We want to, that does a number of things that builds the infrastructure for this. We create get to know all of the law enforcement agencies are involved, and it requires the community service boards to develop adequate staffing to provide the co-responders to these agencies. This is a voluntary relationship as far as the law enforcement goes. It's created to allow law enforcement agencies to move at the speed at which they are comfortable to begin these partnerships. Law enforcement is already responding to individuals in the behavioral health crisis. They're the first ones on the scene, and sometimes it takes 3 or 4 law enforcement officers to try and assist someone who may be experiencing a behavioral health crisis that is acting in ways that are frightening or scary or dangerous. And what can happen is that instead of the 3 officers who will have to spend much time trying to resolve that issue, we can bring in a skilled police officer along with a behavioral health worker that can bring expertise to addressing the problems. And then those other officers who had been called out can go back to their service in other patrol and other activities. Once we accomplish this by creating in each community service board area a co-responder protocol committee. And law enforcement will be sending a representative. Each agency will designate a representative to participate in the co-responder committee. And each agency will also designate an individual to be a primary point of contact for the community service board. And the piece that we will use that to build training for law enforcement. Right now, there is not a uniform training for law enforcement. There is an excellent program, crisis intervention training or CIT training, that we would like to see all officers take, but it's a 40-hour course, and many agencies don't yet have the manpower, the capacity to do that. This will begin to facilitate training of law enforcement officers in connection with the community service boards. We would also, the bill also requires training of communications officers. While 911 is the call that everybody makes, but the research shows us that at least 60% of those calls to 911 would be better served with some sort of alternative response. And in fact, about 40% of 911 calls are made by a family member about another family member who is in crisis. And when we send an officer there who does not have the training, or it has to have the tools to address the individuals in behavioral health crisis, we're not necessarily assisting that family in the way that they may need to be assisted. So we would like to see training. We'll train the communications officers so that they're more adept in recognizing the opportunities to dispatch co-responder teams. And this is a big topic, because in July of this year, the FCC rules will require each communications, Verizon and other AT&T to have a 3-digit mental health crisis line, 988. And so that we think that'll increase tremendously the number of calls for assistance with individuals with in a mental health crisis. And we need to be prepared for that and to serve more people that are not currently being served. The estimates are a 3 to 4-fold increase in the number of calls for assistance. Sure.
I'm sorry. No, you're fine. Thank you, Mr. Chairman. I apologize. The Governor, Attorney General's Gang Task Force meeting is coming up, and I have to be present. But I want to thank the Lieutenant Governor.
What's your microphone? Just to make sure.
Number 3, I think. Okay. I'm on.
It's on.
Senator Watson, certainly, Regina, and the team. I just want to talk briefly from the public safety perspective of how important this is, not just from our public safety committee, but for being a first responder for over 3 decades. For most of the time, this does not exist in a lot of areas today, and this would be a game changer for us. But I want to talk specifically about the communications personnel. Likely this Friday, if not on Monday, you will have a bill in front of the full Senate, Senate Bill 84, which will allow our dispatchers to become part of the POAB. And with that, we also enhance the continuing education required for communications officers for items just like this that the judge and Senator Watson were talking about. And this is so critical because when you think about them taking the call, it's not just a reference, but it's also what they are doing. Today, we teach a lot of our communications workers. You'll see more legislation as well about telephone CPR, or if someone is in severe trauma or bleeding. We teach them what to do if they are under distress, someone's broken into their house. We also need to give even more enhanced training to do some of the basics with somebody on the telephone who might be in some type of a mental crisis at the time, whether it be the direct person or perhaps a family member, as mentioned earlier. So I want the committee to know how important this is, but how we are connecting the dots in order to support just the things that are being talked about right here in real time. And again, thank the Lieutenant Governor for his great work on this. Thank you so much.
Thank you, Senator.
Thank you.
I appreciate it.
Thank you.
Brings it home, because I do think we've got to learn who is taking the call and how are we responding to that call is a key question. And the co-responder model allows us to have that a more skillful response, but it also goes further in that it does two things that we don't have a model for doing right now. One is to create a follow-up visit, a follow-up service to individuals who may have been involved in a behavioral health crisis and through which a co-responder may have responded. And it provides the Community Service Board within 2 days, business days of that crisis, that they will reach out to the individual and try to engage them into voluntary treatment services. Right now, there's not a corollary for that. But what we can do to prevent the recurrence is to try to get people to the services they need to obtain a state of health that they have not had. So that's a key part of this bill. The other piece of this bill that is important is it creates a method of what we call jail in-reach. We know that our jails and prisons have become de facto mental health treatment facilities. We did a study in our jail in Clark County, our detention facility, and we found that 38%, a little over 38% of the individuals who were admitted during the study period had a behavioral health disorder. And that is not where you're going to get better. And it's also not where you can really have access to treatment. So by creating the possibility for jail in-reach through the community service boards and have the opportunity to try and see that individuals are treated hopefully not through the criminal justice system, but through the community mental health system. The delivering services to that group of individuals can prevent their return to jail, because what our study also showed is that those individuals are likely to stay 3 times longer, and they were likely to return to jail at a rate of 53% within a year. So we know that there's a high rate of return, and with a more effective and skillful response, we can prevent that revolving circle. What we found is that when the law enforcement and officers sit and talk with the behavioral health folks, they find that they're serving the same people. And they also find that they can serve them more efficiently and effectively if they're in concert. And the co-responder model, I think, is the most accessible one for us to adopt. There are lots of other models out there, but this one allows us to bring to bear our law enforcement skills and our community service board mental health skills to create this and to create it across the state, and then to have a more effective response. This is all about funding. Everything comes down to dollars. I can't come up here and talk to you and say this is for free. It's not going to be for free, but we've created a process by which that determination of what services can be provided will be determined at the community service board level, that they can analyze what is needed in their service area and then put forth a budget request through the board of the behavioral health and developmental disabilities to allow you as legislators to make the decisions about appropriations to those communities so that they can propose and then implement the effective strategies. Just one other thing about the research on this. The research from the Center for Police Research shows that co-responder teams enhance crisis de-escalation. They reduce the frequency and severity of use of force. They prevent citizen and officer injury. They increase connection to service. Then the use of arrests from crisis incidents is greatly reduced. And also reduce officers' time spent resolving issues like this, and we divert people not just from our jails, but also from our emergency departments. So that's my outline of remarks, and I know we have some other speakers. I hope and certainly will be glad to entertain questions as appropriate.
All right, thank you. I think we will jump to the online presenters, so they're patiently waiting. I think the first one is Dr. Mark Johnson.
Good morning. Thank you, Mr. Chairman, members. I'm Mark Johnson, board certified psychiatrist here in Savannah and on the Georgia coast, CEO of the Gateway Community Service Board, DIO, which is designated institutional official of the psychiatry training program here in South Georgia that y'all helped get going, and was privileged to be on and am on the Behavioral Health Reform and Innovation Commission. So these are issues near and dear to my heart, and so I'm very happy to be part of the association's presentation and support for this bill. I have 3 slides to share with you briefly. The effort in Savannah to do a co-responder program began about 5 years ago with a city-county effort that back then involved consultation with National Council of Cities, that evolved national county organizations, and then finally, as Major Gavin will share, a grant that enabled the Savannah Police Department to partner for this effort. We are well aware that different communities, different resources, different law enforcement structures and needs do mean that different models for implementation of this model are necessary, and we think that's appropriate because this is local. The patients are local. Everybody touching them and being affected by them is local. And so knowing each other is local, even insofar as it's best for training to be local, even if we're using a common criteria. I'll pull up the first slide, and these may be slides you're familiar with. This is the sequential intercept model. Most of what we're talking about and most of the way that co-responders work together is in this intercept 0 and 1. If you're not familiar with this model, let me just say this really focused our discussions in Chatham County and Savannah because we're all trying to solve aspects of these issues throughout the whole spectrum. And that's very difficult. But when we focused in on intercept 0 and intercept 1, we found we could actually make progress there and focus on each intercept separately. The goal of the co-responder approach, however, whatever particular model you implement, really is to get the right intervention by the right team, the right people at the right place on the right day. And so the real outcome is based on the true needs of the person who needs help, which may change week, which do in fact change week to week. Another key piece of this and reason for the community service board role really is the continuity of care. When law enforcement interacts with somebody, there are all kinds of things that person may need. What they may need least of all is to go to a hospital. And so being able to partner with the community service board, which has the full continuum of care, enables a selective use of the appropriate community resources. In Chatham, Gateway provides the employee, behavioral health, mental health employee, who's in the ride along program in our behavioral health units, which Major Gavin's going to talk about in a minute. But I'd say if you look at this continuum, this is not everything that a community service board does, nor is all the resources, but it does kind of capture the spectrum from outpatient around inpatient, observation units, those crisis units in the BHCCs, the ACT team, which is a hospital without walls, case management, which many of these people do need, the peer clubhouse programs, various respite care programs, interaction with the mental health court, and then residential programs where that's a need. So it's a very thorough, very comprehensive approach. And I'd be glad to take questions and turn things over to Major Gavin, who can really get into a little more detail and color on how this works.
Okay, briefly, if there are any questions for Dr. Johnson. Don't see any. Okay. Major Gavin?
Afternoon, Mr. Chairman, Board. Thank you for having us today. I just wanted to start off a lot of the things that the Judge Sweat has said and Dr. Johnson has kind of outlined what we do. We were lucky to get this grant to allow us to do the co-responder program, and we've had a lot of success. And it's something, and I've said this from the beginning, that most communities are dealing with these mental health issues, substance abuse issues, and they're not going away. This gives us an opportunity to go at something differently. And we've seen a lot of successes just over our first year finishing up. And what we do is we have a clinician that rides with 2 designated officers. We're hoping to expand that, as funding becomes available. But those 2 officers are trained both in, they both have backgrounds in CIT, but we also created a secondary program called the Enhanced CIT, which really helps them identify certain people in crisis and what they're seeing. And then also it brings in all of our community partners from our collaborative, so that every officer who goes through this, dispatcher, fire department employee, EMS employee, we train all of those people along with all of any other surrounding agencies that want this training. But it allows them to see what these providers do, where their buildings are. We take them on a tour of the Behavioral Health Crisis Center Gateway, and they learn what they have the ability to do, times that they're able to do it. And this allows everybody to really get an understanding of what services are available. But once they get through that training, our officers ride with the clinician, and they respond to those calls that they spoke of earlier, where you may have 4 or 5 officers going to someone who was dispatched as a disorderly person. But it turns out it's someone in some kind of a crisis state. And they will then take over that call with the clinician, relieve those other officers to go back and start working on other policing functions. And though they work, sometimes it could take 2 hours, sometimes it can take 4 hours. We've even had a case that's taken 8 hours. But they bring it to conclusion. They take that person, they put them in they do a handoff that is, get them into the services, get them stabilized, make sure they're safe. But then the piece that we do after that is then we go back and follow up. So say 30 days after someone either comes out of services or starts maybe missing an appointment or doesn't show up, we, along with the clinician, go to that person's residence and find out if everything's okay. Is there something getting in the way of them getting to their services, whether they need a ride or maybe a job issue or something like that. And what we do is try to find solutions to help them continue on and stay on track, whether it's going to counseling and getting medications, anything that is. And that what we found out of that is that the people that we've dealt with over and over and over again, once we get them on that track and help them stay on that track, we no longer are getting those calls that we were getting for them. So we're reducing the amount of law enforcement involvement, which of course, anytime there's law enforcement involvement, and like Dr. Johnson said, it increases the risk of having to use force and all those type things. So our officers are there to mainly de-escalate. They're softened. They're not dressed like me. They're dressed in a light blue polo shirt, and their whole appearance is softened, along with the vehicle they drive is an unmarked Explorer with tinted windows to take away embarrassment or anything like that, so that people aren't like the police are in front of your house or things like that. And so all of those things together help calm things down, make it more establish communication. And so we continue to do this since we started. We've intercepted hundreds of calls, but we have specifically taken onto our roles as of today over 175 people that our officers monitor, go back and check, and do pieces like that. One of the most interesting statistics is of the ones that we have been involved with prior to us having this in place, we had, I believe it was almost 90% of the subjects that were dealt with ended up going to the jail for whatever, incident that was that had them having that police involvement. Since we've been in place, of the people that we've dealt with, we've completely flipped that number. Only 10% have gone to jail, and over 90% have either gone into services, gone to the actual hospital, or calmed down, helped out, and released from the scene or taken back home after the incident. So to me, that's what we're looking for. We're looking for an alternative way of, because you're not going to arrest us away. We're going to spend a lot more money arresting people than we will finding them these services and getting them the help that they need. And so all of these models, like the doctor said, are localized. What we do here isn't going to work somewhere else, and vice versa. But what we do want to do is give our groups the ability to train locally and use the models that we have locally. Localize our training. When part of our training is bringing in someone from Savannah who's had a mental health issue in the past or has had a drug issue in the past, and they come and talk to the group. They explain all of the things that were going on. I think it has a lot more weight, a lot more bite when they see someone locally who has succeeded and talks about their issues and talks about all of the things that, how they viewed the police, how they viewed hospitalization, how they viewed, counseling and things like that. So our hope is that, as this moves forward, there's both funding, but then also, the ability for us to, as a community, deal with some of these issues. And again, thank you for having the time to hear us out.
Thank you, Mayor Gavin. Anybody have any questions for Major? What number are you? Okay, you have
Thank
the
you,
floor.
Mr. Chairman. And thanks so much for that testimony. I don't see him still on Zoom, but I thought we got a great example of on the ground, real time, practical application of this. So it was just excellent and very helpful. A couple of questions. Was the Community Service Board involved in this? You may have said that, or the psychiatrist that spoke before you may have said that.
Yes, ma'am. That they are a daily part of what we do. They are our partners, and Dr. Johnson was really, instrumental in helping us put this program together.
And you referenced a grant. Could you refresh us? Where did that grant come from, and how large was it? And what are your plans?
Yes, ma'am. We received we were sub-grantees through from a federal grant, an opioid grant. And that opioid grant, we showed this model because most of what we deal with is co-occurring issues. So it's mental health and substance abuse. And so because of those issues together, we received it was a $756,000 grant to get started. And that was everything from vehicles to equipment, and then personnel, and then training. So we have analysts. We have, we're tracking all of it. We have a dashboard put together so that we can see all of our people that we've been in contact with, and then able to follow them and keep up with that. I got to say our numbers are getting bigger. We've had a lot of successes, on the follow-ups portion of it. But I think one of the main pieces is the ability to have a clinician with them when a crisis situation's happening. We've saved lives doing that. We've had people there when people were threatening to hurt themselves and do things. And they've spent hours sitting there talking to someone. One of the doctors from Gateway came to one of the scenes and talked to somebody to help them get through that. And so all of those successes are, I think what we're looking for as a community and as a police agency.
Thank you.
If I may, I would second that. There was someone indeed considering jumping off a bridge, and the unit brought a board certified senior psychiatrist to the scene. We train psychiatrists, and those people also do ride-alongs. So we're really developing that local relationships that we hope and expect will carry over to other communities. And it's really a pleasure to be working with Major Gavin and the county and the city on these efforts.
Okay, thank y'all for your presentation, and we're going to move on. Tammy Conlon, go to the podium over there for us. Tell us who you represent. Thank you.
Good afternoon, Chairman and committee members. I am with Advantage Behavioral Health Systems. I'm the CEO, and I'm also a licensed clinical social worker. So I appreciate the opportunity to share a little bit about what has been going on in Athens. So in 2017, Athens Clarke County Police Department created a crisis response unit after receiving a Justice of Mental Health grant. And their first co-responder team was established in collaboration with Advantage Behavioral Health Systems. The co-responder teams, as you've already heard, are comprised of law enforcement. So we have a Athens Clarke County police officer and an Advantage fully licensed clinician. However, the partnership between Advantage and Athens Clarke County Police Department actually started in 2015 as a joint effort to respond to increasing behavioral health issues encountered by law enforcement. Data was collected to determine the specific needs of Athens Clarke County via a community needs assessment, and it also included stakeholder interviews. So 2 in-depth studies were done in 2015 and 2017 to determine baseline data related to the number of people with behavioral health disorders who were in jail. In addition, arrest and booking records were compared with Advantage client records, and criminal histories were reviewed against the jail database. In early 2017, a team from Athens traveled to Johnson County, Kansas to review their criminal justice and behavioral health partnerships, including their co-responder model. And immediately following that trip, Athens Clarke County government passed a resolution to join the National Stepping Up Initiative to reduce the number of people with mental illness in jails. The results of the needs assessment and in-depth studies supported the need for a co-responder team to respond to calls with suspected behavioral health concerns. Our first team is available to respond to these calls and provide training and review police reports Monday through Friday, 8:30 to 5. But in 2021, we added another team. And so we've had 2 teams fully operating full-time. And then we added a 3rd team in September. Those teams are scheduled Monday through Saturday, 10-hour shifts, and they're during the high volume times. We found that Sunday was not a day that there were a lot of calls. So the other times it was felt it was more needed. In 2021, the following outcome data was collected by our teams. There were 2,334 police reports reviewed against Advantage medical records to determine follow-up options. This is significant in terms of our ability to alert treatment providers of escalating psychiatric and behavioral health issues with clients that they would not otherwise know about. This kind of information allows us to work more effectively to prevent crisis situations and to manage behavioral health issues before they escalate further. There were 876 coordination activities provided for needed services. And I want to point out that the individuals served by co-responder teams are not limited to community service board clients. These teams serve the entire community and often provide coordination to individuals who are insured and who would otherwise not be touched by the local community mental health provider. There were 452 outreach services provided to police identified individuals either in person or by phone. 281 were in person and there were 171 by phone. 237 mental health assessments were completed by the clinician co-responder while on call with the police department. Only 16% of those assessments resulted in a need for a 1013. Co-responder teams participated in over 100 community meetings and collaborations in 2021 with local organizations and businesses. When not on call, co-responders made 20 visits to local homeless camps to provide outreach and have been involved with local community groups assisting unhoused members of the Athens-Clarke County community. The teams provided 52 training sessions for local community members, law enforcement, and interested parties statewide. This is an average of 1 training per week for the year. So co-responder teams have benefited the Athens-Clarke County community, and we are planning to add up to additional 4 teams and also an outreach, in jail outreach behavioral health specialist. Thank you.
Thank you. Is any questions for Ms. Conlon? I don't see him. Thank you. Cindy Levi.
Chairman Watson and committee members, good afternoon, and thanks for the opportunity to share my support of Senate Bill 403, the co-responder legislation. I am Cindy Levi, CEO of Avita Community Partners, the Community Service Board, or CSB, providing behavioral health services to the residents of the 13 counties of Northeast Georgia. And I am also a member of the Behavioral Health Reform and Innovation Commission. I present to you today with 40 years of experience in the mental health field and 20 years as a crisis intervention trainer for law enforcement. I'd also like to address you on behalf of the thousands of families whose loved ones live with a mental illness, like my close personal friend, Christine. Christine's son, David, is a proud graduate of UGA with a degree in economics, who aspired to a career in public service. A few years ago, while home with his family, he experienced a psychotic break. Because the concern for violence was imminent, his parents called the police for assistance. When officers arrived, Christine explained that her son was experiencing a psychotic break and required transportation to the hospital. Against his family's wishes, he was transported to jail, charged with a felony, and languished for over a week in jail without his medication. According to a report from SAMHSA, the Substance Abuse and Mental Health Service Administration, only 17% of individuals with a mental illness receive their mental health treatment while incarcerated. The legal battle that followed, the money spent, and the heartache experienced during this horrific event could have been avoided if a co-responder team was dispatched to their home that day. Avita formed a partnership with Sheriff Freeman and his team of deputies in Forsyth County with the goal of reducing incarceration of individuals experiencing a mental health crisis by assembling a co-responder team in the summer of 2020. Federal grant funding was obtained to support this venture. The team composition includes a sheriff, Sheriff Terry Hawkins, a sergeant from the Sheriff's Department, Sergeant Terry Hawkins, a licensed mental health clinician, and a certified peer specialist, or CPS. In their first full year of operation, the team responded to 381 calls for service. Now remember, 381 calls, resulting in only 3 arrests. There were 285 individuals assessed by the licensed clinician, and 37 individuals required an involuntary commitment for a comprehensive mental health assessment. A large majority, 248 of those calls, were resolved peacefully at the scene. Over 440 encounters were initiated to engage family or caregivers to support their loved ones, and 486 connections were made to additional community supports. The unique role of the CPS, Certified Peer Specialist, is to provide follow-up after the initial encounter to ensure the cause of the initial call for service has been diffused and there is connection to ongoing support and resources to avoid future law enforcement encounters. Over the year, 687 face-to-face meetings or follow-up calls were made to check on individuals following encounters with law enforcement by Josh Bell. He's with us today. Josh is our CPS on our team. He also participated in 99 jail in-reach opportunities to assist with discharge planning with inmates identified with a mental health diagnosis for a smooth transition back into the community, thereby reducing recidivism. The use of grant funding for startup seed money made this possible. However, a longer-reaching sustainability plan for continuation of these services is needed. I respectfully request that funding is appropriated to support co-responder programs across the state. The team also provided over 1,100 training hours to the rest of the department on topics such as abnormal behavior, suicide prevention, officer resilience and wellness, mental health transports, teen mental health, and co-occurring disorders. These trainings prepare all officers for the possibility of an encounter with an individual experiencing symptoms of mental illness. Finally, I'd like to address the best practice of using CSB staff as clinical partners with law enforcement. The CSB staff are members of a much larger team of clinicians, prescribers, case managers, and peers that connect with the full continuum of services offered with consistency and continuity of care provided by the state's safety net provider. This partnership eliminates the risk of a fragmented parallel mental health system competing for scarce professional resources. Again, thanks for the opportunity to share this testimony, and thanks for your support of Senate Bill 403.
Thank you. Any questions? All right. What number are you, 5? Go ahead.
Thank you, Mr. Chairman, and thank you for your presentation. I just want to recognize the Forsyth County folks that are here. Thank you guys for being here. I know Sheriff Freeman, who's in the back, has some of those statistics that you just mentioned. Would it be possible to share those with the committee on the handout that I was given so that they can review those as well?
I
Do you have
don't,
additional
do you have
copies,
any?
Sheriff?
I didn't know
be
Sheriff
great.
was still here. Oh, there he is.
He's next on our list, so we can hear from him next.
Thank you, Mr. Chairman.
Thank you.
Sheriff Freeman, you can come up to the floor. And we are running a little long, so
I'm a Southern boy, but I can talk fast, Mr. Chairman.
I like it.
I bring with me Sergeant Terry Hawkins. He is my team lead of our critical incident response team, or our co-responder model. So I'd be remiss if I didn't say, one, Chairman, thank you for carrying this. Thank you to Lieutenant Governor, who's from Forsyth County as well, and then my friend Senator Greg Dolezal and Senator Albers as well. I will tell you, everything's been said. I'm not here to parrot things, but I want to bring a couple of points to you. I'm blessed in Forsyth County. I can afford to put deputy sheriffs in a critical incident response team or co-responder model. Sergeant Hawkins was an existing employee. I reassigned to that. We're blessed that we just got a grant from the Criminal Justice Coordinating Council, where I sit as a board member, to start team number 2 and 3 up in Forsyth County. Absent that, that's going to be a little difficult for some agencies to do. So I bring that to you that I can tell you, I have physically watched this team save lives, but the challenge is going to be to find the funding for sheriffs and chiefs to be able to do that. And so I will remind you of that's going to be important to do those things as we challenge. As we go along, look, the concept is well, I don't think anybody's here opposed to this concept. Thank you for working with us on some of the language that would have been a little bit difficult for us to meet in law enforcement. But I did bring Sergeant Hawkins here if anybody has any questions. For somebody who literally is on the ground, who does this every day as a full-time, he's here and be happy to answer any questions you might have of what this actually does and what it actually looks like. Other than that, thank you for the support. Thank you for working with us on language from the sheriff's side of the house. Please just understand that we're going to have to find some funding for this because it's going to be difficult for a lot of agencies to do, but the benefit is worth the squeeze on it. Thank you, Mr. Chairman.
Thank you. Again, we are limited. I've got Terry Norris. Do you have anything specific to add? I'm not going to say that I agree with you. All right. Thank you. And Dan Snipes, we got a couple more folks to testify. We're going to open up for questions as soon as these folks finish.
Thank you, Mr. Chairman. I'm Dan Snipes. I'm an attorney in Statesboro, Georgia. I'm a past president of the Georgia Trial Lawyers Association and represent them at the Capitol now. And certainly, I don't speak in opposition to the thrust of this bill or in any way think it's bad. It's great policy. It's something that's needed. I've represented people who have been in crisis and recently actually had to serve as a pallbearer at a funeral for a former client who had mental health issues for a number of years, who took his own life. So this is something that's very much needed. I do want to point out, though, that I think there are provisions in this bill related to immunity from civil lawsuit for the transport of persons that has unintended consequences. And I want to make it clear to the committee that I think the language as drafted, and specifically I'm looking at the language in section 3 on line 54, starting on line 54, and I'll use that as an example. When there's immunity from civil liability for anyone's actions in connection with the transport of the patient. Okay, the language in connection with the transport of the patient goes beyond just the patient as you deal with admission, discharge, and other parts of immunity that are here. When you're in connection with the transport of a patient and you're driving someone down the road and someone crosses the center line and hits somebody, they miss a stop sign and hit somebody, then you're extending this immunity to acts that harm the general public. And I don't think that's the intention of the statute. And quite frankly, as drafted, the immunity provisions are just too broad. That's broader immunity than we give law enforcement when they're responding to a 911 call for a criminal emergency. It's broader immunity than we give a county ambulance that's responding to a medical emergency. Private ambulances don't have that kind of immunity when they're responding to a medical emergency. It's much broader immunity than we give basically anyone else that's responding to other types of emergencies. And certainly we want to create every incentive we can to make sure people who are experiencing a mental health crisis get the care they need. But the provisions in this statute related to transportation are too broad because it goes just beyond the patient. It also goes to the public. So I would ask the committee to consider striking the word transport in line 54 and striking the transport of a patient to a physician or facility in line 55 and 56. The same language appears in line 72, 73, and 74. And the word transport in line 266. I'm here to answer any questions, and I want to keep this short because it's a very limited thing I wanted to address.
Okay, thank you. Mr. Chairman, you have any specific concerns with that?
We have attempted to work with Mr. Snipes, several different versions of this. Our intent is to give the same immunity that law enforcement has, not a private ambulance service, but law enforcement. Our attempt is to give it the same, because as you heard, whether it's in Chatham County or Forsyth, it is a law enforcement person, though they may be dressed in a different uniform and may be in an unmarked car, it is still law enforcement peace officer. That's what our intent is. If it is not accurate, then we'll be happy to work with him along the way.
Okay, we're going to lose a quorum, so we're not going to have a lengthy discussion.
Understand. I'm just
on the
wondering if
issue,
there was a
so
question, I'll be glad to answer any questions.
Thank you.
Thank you.
And last, but not least, Jeff Breedlove, is there any just burning things that you have to say?
I don't want you to lose your quorum, Mr. Chairman. Jeff Breedlove, Georgia Council on Substance Abuse. I'm a person in long-term recovery. First, quick thank you to the Lieutenant Governor and to the chairman for carrying this bill. I'm here to speak in favor of it on behalf of the peer community. I am a person that this bill would have impacted had it been in effect. And I have spoken to many of my brothers and sisters across the state who are wholeheartedly thankful. And I'm basically here to say thank you for this innovative step. We know there's work to be done on budgeting. I want to thank our friends in law enforcement who are changing their hearts, and my peers who are changing our hearts as we grow relationships stronger that have historically not been there. We are so thankful to law enforcement. I will end with this. I was texting with one of the CSB components just a minute ago from Polk County. I have met the chief of police in Cedartown and the deputy that has had peers already doing this. And I just want to say that it's the council and the recovery community organizations that are a part of the CSBs. And on their behalf, we want to say we are excited about where this will go. And we thank you so much.
Okay, thank you for your testimony. Chairman Watson, I'm gonna let you see if you wanted to answer questions from the
Yeah,
committee or.
we'll be happy to answer questions. I do want to add that Michael Nix, who is the state 911 director, is here, and he can certainly answer any questions relating to education, including education as dispatchers, which they actually run that course here. So, and with that, Judge Sweat and I are actually happy to answer questions from the committee.
What number are you, Senator? 3. Okay, you have the floor.
Thank you, Mr. Chairman. Chairman Watson, turn to page 7, line 48. My question is this. It says each community service board shall employ or contract with a behavior health professional.
Yeah. You said line 148.
I'm sorry, I'm sorry, 148.
148. I thought you
Page
said
7,
48. Okay.
I'm sorry, page 7. It says each community service board shall employ. Is that an extra employee that we're tasking each community service board to employ? That might be a burden on their.
No.
The provision that is key here is it's subject to availability of funding. They're not going to have to hire someone for whom they do not have the funds, but they will be hiring folks to fill the role of the co-responder to work with law enforcement.
So when they submit the budget to the state, if they fill that position, then they can hire someone.
Yes, the plan is that the CSBs will do an analysis and work with the agents, law enforcement agencies in their community to see how many co-responders they may need, what will be needed for that program, the certified peer specialists, and then submit that through the Board of Behavioral Health and Developmental Disabilities to get funding for the agency in the amount that is appropriate for that community.
In other words, it's subject for approval.
It's subject to approval for funding.
Okay,
Yes.
thank you.
Let me interrupt, y'all. We don't have conversation without being recognized by the chair. Line 241 in the bill actually has the language that defines that this is subject to appropriation by the General Assembly and much other information about the possibility of getting other grants and donations and so forth. So that's on page 11 of the bill. But if somebody has a question now, I'll be glad to recognize you. Okay. All right. What number are you? You have the floor, leader.
Thank you, Mr. Chairman. I'm concerned about what Dan Snipes just pointed out. Can we adjust that? Because it sounds like from what he said, that this person on the CSB board, it's going beyond what a police officer can get immunity for. Isn't that something that we can adjust? I really want to vote for this bill. This is a great bill. I think our community service boards at DeKalb County would be amenable to doing just this. I think they may be doing something similar to this anyway. So I'd like to see those lines that Mrs. Snipes mentioned, 72, 3, and 4. And then on the other page, it's line 55, 54, and 55. If those could be adjusted to not give people more immunity than you do police officers. I don't think that's, it makes sense to me.
Okay.
Any other question? Okay.
Yeah, let's do one thing at a time. Chairman Watson.
Let me just repeat, we've asked them for language to limit it. We're not going to strike it out. At least that would be my recommendation. And we'll be happy to work with them moving forward, but we need a little bit more
Okay.
discussion on this.
That's fine. And the other question on page 11, line 241, is contingent upon the appropriation. Do you have any idea what that number could be?
Well, when you're talking about, and I'm more familiar with the co-responder side of the behavioral health side than the law enforcement side. I think, law enforcement officer, depending on the rank, is going to be somewhere without benefits, $60,000, $70,000, and that's kind of gone up. Behavioral health side, you're probably looking at 225, 250,000 for the clinician, which is 75 to 85,000, peer specialists, which is about 35,000. You're going to add benefits. You got some support stuff that is needed in order to support the work. So, those are round numbers. And it's one of the biggest challenges we have is finding the behavioral health folks. That's been a real challenge. And I think we're going to have to look at that pay scale, but that's also something that we're going to have to develop as we put forward budgets. But $200,000 to $250,000 is probably more nearer to 250,000. Am I off base? It's kind of ballpark for the behavioral health side, which this bill really addresses the behavioral health side.
Okay. I just wanted some idea of what kind of
I mean,
money.
and if you look at, how many teams will we need? Well, some community service boards may be able, in using technology, to serve more than one police agency, but some may need 3 to serve a city like Savannah or for other counties.
And one of the things in the bill is that the community service boards will look at and identify what their needs are and come back with a recommendation. So that is addressed a little further down in that same section of the bill. Senator O'Rourke.
Thank you, Mr. Chair. Yeah, without being tiresome on this or sounding like a broken record, it really makes sense for the committee to, I think, to get a little clarity on this question of the transport and the liability, because I thought I heard 2 different things, in that dialogue that occurred.
Right.
So I'm just trying to understand. Can we all agree on a set of facts about that, about whether that level of immunity is just what police have already, and it's extending it to all of these health officials and physicians and psychologists, or is it not? Because I thought I was hearing 2 different things.
One point, if I could make this, is that community service boards are already agencies of the state of Georgia. So we may not be adding much immunity. Now, to the extent we're talking about transport of individuals in vehicles and crossing the center line. I think there's some other provisions for, and others may know better than I about how our insurance, the waiver to the extent you may have insurance to cover that type of thing. And that's what we want to give these individuals the immunity that would perform in their professional capacity. I don't think we're intending to make someone not responsible for a traffic error, but then there are some other methods and routes for people to address the issue of sovereign immunity. But already these CSB employees would be subject to immunity as an instrumentality in the state of Georgia.
Well, if I could follow up, the language is, and somebody implied at a private hospital, or it's either is operated by the state or not operated by the state. So, and it's the key thing is adding that transport language, because it's totally understandable that the admission and discharge provisions, but the transport, when you're out on the open highways, that's when the public interest is served by being able to pursue their day in court if they're injured by some accident that happens of this vehicle with this people or person driving.
Okay, Senator Roy, I think you've made your point. We're going to move
Well, I
on
thought I was
along.
asking a question.
Senator Cowser.
Thank you, Mr. Chairman. Either of you, Judge or Senator Watson, isn't the point that we want to encourage people to offer their services to provide help to these mentally ill or people in mental distress rather than deter them because they're afraid they might get sued for trying to help get a person to get, examined and treated?
Certainly that is the case. We don't want to present a disincentive. And I think the distinction here is he's speaking, Mr. Snipes speaking of a situation where creating liability for a traffic accident versus providing the immunity that someone needs in order to carry out their functions. And I'm not expert enough on what I've been, Mr. Cowser may know better than I about immunity for traffic vehicles, but usually there is provision for those types of that already exists for other law enforcement. That's what I'm getting to. It's that would already be in place separate and apart from this.
I'm going to interrupt. The chairman has already pledged to continue to work with the association on this issue. And so I think we need to move along. We're going to lose a quorum, and I would like to see what the committee thinks about moving this bill forward. Right now is the proper time. Senator Dolezal has moved to pass on LC 3390007S. Do I hear a second? Second from Senator Kirkpatrick. Any further discussion? All those in favor of the do pass motion, please raise your hand and keep it up until our assistants here confirm they've got your count. All right, those opposed, like sign. Everybody has to vote. Are we good? None opposed then? Okay, I'm just not as quick as y'all are with my neck here. Okay, I think we're done with the business of this committee. Thank y'all for your attendance and patience. We're adjourned. Thank you.